You do not need to fix your disc herniation or fix your disc bulge. Probably, in most cases. I'm Dr. Anthony Davis. Let's talk about disc herniations, disc bulges, and all things discs, and what you don't need to do about it, and do they cause pain? It's not what you think. Let's start off with a little question, right? So if we have an MRI, we're looking at two MRIs. I want you to pretend like you're a doctor and you're looking at two people's MRIs. And you see these two images right here. And you're thinking, okay, well, this person over here on the left has weird curvatures, scoliosis in their spine, and this person has a nice straight spine. So you're probably thinking, well, obviously the person who has something wrong with their spine, quote unquote, is the person who has pain in their spine. Well, let's check it out. But before we do, let's also assume, let's say we can see, because it's an MRI, let's say we can see their discs and we can see that they have disc herniations as well. Then you're really probably thinking that person has pain for sure. Well, it's not what you think. So here we have a tale of two studies. So this is kind of a balanced perspective. So here's the deal. Right now there's a lot of modern pain science and they're basically telling you disc herniations don't matter, form doesn't matter, your alignment doesn't matter, nothing matters, pain is all in your brain. Well, that's kind of true, but it's missing context and it's kind of an extreme point of view. So these two studies, I think, provide a very balanced perspective to understanding how structure can influence pain, but structure does not determine pain. So the first study that we look at here is by Brindjic in 2015, and they later did this another study in the same year. Now, the first study was an asymptomatic population. They looked at 3,110 people, and they wanted to see, well, these people have no pain whatsoever. They do not have back pain. So we would expect that if we look at their MRI, that they should have really healthy looking spines. They should have very good, perfect looking spines because they don't have any pain. But the weird thing was that they found that, well, actually, most people who have no pain whatsoever actually have something quote unquote wrong with their spine. So I cherry picked here this 50-year-old statistic, the 50-year-old statistic, because that's a good middle marker. But if you actually go to the original study, you can see any age, right? So they looked at the full lifespan and they saw, 30-year-olds and 90-year-olds. And so I picked the 50-year-olds to highlight here because you can just add a little bit or subtract a little bit. So for example, here we have 80% of 50-year-olds will have disc degeneration and yet they will have no pain. That's pretty powerful in my opinion, to say that just because you have disc degeneration, actually most people have it and don't have any pain. So I said 50-year-olds, and if we looked at 30-year-olds, it would be less than 80%. And if we looked at 90-year-olds, it would be more than 80%, right? So it'll be just a little bit more or less common depending on your age, but 50-year-olds is kind of a good middle-age marker here for how common is this stuff. So again, 50% of 50-year-olds will have disc bulges, and yet they will have no pain whatsoever. So that's really, really interesting, right? Because we would assume that if you have a disc bulge, you must have pain because disc bulges are terrible, right? Everybody thinks that disc bulges are the worst thing on the planet that can happen to your low back. Well, they're not. They're actually really, really common. A disc bulge or a disc herniation is basically a little swelling on the back of the vertebral bodies in the spine. So a little swelling, a little bump on the spine, not a huge deal. However, Brindjic did another study in the same year, and he looked at symptomatic populations. So he looked at people who, actually I shouldn't even say he, I am so sorry. I actually don't know who Brindjic is. They looked at a symptomatic population, and they found that there was, so they looked, okay, these people have back pain. Now let's look at their MRIs. Do the people with back pain have more disc bulges? Is it more common for them to have disc degeneration than people who have no back pain? And they did find, yes, it is a little bit more common that if you have pain, then you probably have more disc degeneration, more disc herniations, etc. So yes, it is common for people who have pain to have a little bit more stuff going on in their spine than people who have no pain whatsoever. However, the difference is pretty slight. It's not a huge difference, right? Because again, 80% of 50-year-olds will have disc degeneration with no pain. 50% of 50-year-olds will have disc bulges with no pain. And the percentages at the same age, however, with pain, is only slightly higher. So there's a slightly increased chance that you might have some pain at some point if you do have a disc degeneration, if you do have disc bulge, disc herniation, etc. But basically, these things are really, really common in people who have no pain. So you don't need to fix it, because we can just turn a symptomatic disc herniation or disc bulge into an asymptomatic disc herniation or disc bulge through exercise and time, because most disc herniations actually heal themselves within 6 months. They completely heal themselves within 6 months. 2/3 of them will do that. So you don't necessarily need to, quote, fix your disc herniation or disc bulge, which means that if you have an MRI, and this is why we don't get MRIs of people's spines right away, because people freak out and then they get in their head of like, oh my God, I have a disc herniation. And then they come see me in clinic and they come in and they say, oh, I've got back pain and it's because of my disc. And I say, well, when was your last MRI? And they said, oh, I had an MRI 10 years ago and I had a disc herniation, and that's what's causing my pain now. What? Well, did you have pain this entire time? Oh no, it kind of goes away and then it kind of comes back, whatever. Okay, have you had another MRI since then? Well, no. Well, you might not even have that disc herniation anymore. It might have healed itself, so you don't even know that. And second of all, you had lots of time in between there with no pain, but your disc herniation may have still been there, and if it was, then how did you not have pain during those times? The point is that having a disc herniation or a disc bulge does not, that fact alone does not mean that you therefore have pain, right? You have to have a disc herniation plus chemical sensitivity, plus fear avoidance behaviors, plus deconditioning in the spine, plus attitudes and beliefs of trying to avoid, activity, et cetera, plus, your genetics matter, plus your nutrition matters, plus your sleep matters, plus your, stress relieving activities matter, plus are you an alcoholic, plus are you a smoker, plus, you know what I mean? It's not just the disc herniation. So if you have a disc herniation, but you take care of all those other things that I just named, then the disc herniation itself, only the disc herniation, doesn't usually matter. Sometimes, in really rare cases, it does matter a lot, but most people, it really doesn't matter at all if you take care of all these other things. So yes, a disc herniation is a piece of the pie of what causes pain, but you don't need to fix that thing. You don't need to have surgery on that thing necessarily. If you haven't tried physical therapy, if you haven't tried exercise and getting back to normal activity, because most of the time they heal themselves and most of the time you can fix your pain, because motion is lotion for the spine, movement is medicine. I am Dr. Davis and I'm done ranting for today. Leave your questions in a comment and I'll see you in another video.